man down at 746 Crestview Road.
Roger. What's the status?
He's lying in his driveway, that's all we know.
All right, we're on it. This should be interesting. Sir. Sir, can you hear me? We gotta move quickly. Looks like he passed out while he was getting the morning paper. Wonder how long he's been lying here. He's not breathing. I hate calls like this. And what liter flow? 100% oxygen administered. Wish we had more to go on. I mean, history, an eyewitness, just something. What do you think that rhythm is? Look at this. Notice that nasty chest scar? It's gotta be from heart surgery. Okay, it's removed. Good move. Okay, normal saline administered. Good going. Alright, looks like the ET tube is properly positioned. Ah, okay, I see. Good going. I wish all EMTs paid as much attention to detail as you do. Alright, looks like the ET tube is properly positioned. That's it. You're doing great. Just wish he was responding. Pulse present with chest compressions. What medication should be administered? Yeah, that makes sense. Okay, I see what you're doing. Nice. Med circulated with chest compressions. So which one of these should we give the patient? Medication administered. All right, flush administered. Med circulated with chest compressions. And what do you see on the monitor? Right, that's what I think too. Good call. Way to hold up under pressure. Okay, which one of these should I administer? Good choice. All right, flush administered. You're on a roll. Don't stop now. What medication should be administered? Yeah, that makes sense. Keep it going. You're in the groove. You got it. Keep it up. So which one of these should we give the patient? Right, that's what I think too. All right, flush administered. Pulse present with chest compressions. Okay, which one of these should I administer? Right, that's what I think too. Yeah, all right, that's it. Med circulated with chest compressions. What medication should be administered? Yeah, that makes sense. Things aren't looking too good. Well, I just called Dr. Woolridge to consult with him, and he suggests that we discontinue resuscitation efforts.
This wasn't your fault. Sometimes, regardless of what we do, what precautions we take, people die. That's just the way it is. You did the best that anyone could do. Tough case. Asystole may result from a variety of causes, including extensive myocardial damage, hypoxia, electrolyte imbalances, hypothermia, acidosis, drug overdose, ventricular aneurysm, and acute respiratory failure, among many other causes. I concur with your diagnosis. Overall, you did an excellent job in treating this patient.
Yeah.
You got a 48-year-old male with chest pain at Madison Steakhouse.
Is that the restaurant just off Morningside on Franklin?
Yep. The patient's name is Tom Crowley.
All right, copy. We're on our way. Mrs. Crowley?
Yes.
What seems to be the problem?
My husband's having chest pains.
Mr. Crowley, when did the pain start?
As soon as we got here.
About 10 minutes ago.
All right, can you tell me where the pain is?
Here?
Anywhere else?
Yeah, my left shoulder, and my arm's beginning to tingle.
On a scale of 1 to 10, how would you rate your chest pain?
A 9. I think I'm gonna throw up.
Please don't let him die.
Of course, at Madison's. High blood pressure, that's all. Wednesday, right?
Yes, dear.
Nope. I broke out in hives and had difficulty breathing the last time I was given penicillin. I take Prinavil. It's for my high blood pressure. My father and 2 oldest brothers died from heart attacks. I have 2 other brothers. One has diabetes, the other has high blood pressure. No, I do not. Not really. Had lunch around noon and I just drank some water a few minutes ago. No, never.
We barely finished ordering when I noticed something was wrong.
Patient complains of severe chest pain. And what liter flow?
It's our anniversary. We were going to dinner to celebrate. He takes pills for his high blood pressure. I usually keep them in my purse, but tonight I left them at home.
Pain radiates from his chest to his left arm.
It'll be all right, honey. Looks like they're taking good care of you.
So which one of these should we give the patient? Medication administered. What medication should be administered? Right, that's what I think too.
You're in good hands, dear.
All right, better get him in the ambulance. Okay, which one of these should I administer? Yeah, good idea. What medication should be administered? Good one. Nice job. Outlook's looking up. Got a code 3. We need to get to County General.
Any ideas as to what's happening? Pulse is present. Looks normal to me. Okay, lab work drawn. Now, what medication do you want me to administer? Nice work, doctor. This patient's lucky to have you, doctor. Which one of these meds does the patient need? Medication administered, doctor. You know, sometimes you make it look easy. Now, what medication do you want me to administer? Great choice, doctor. You handled that like a pro. What should I administer, doctor? You made the right decision. Good. Really good.
Anesthesiology, please report to 4 West ICU. Dr. Graham,
Now,
please dial
what medication do you
extension
want me to
4528.
administer?
Dr.
Got it. I'll schedule him for the angioplasty.
Doctor, do you recognize that rhythm? Yeah, I agree. He looks much more at ease. Pulse is present. Which of these meds should I administer? Okay, medication administered. Looks like he's improving. Pulse is present. Thank you so much. He's all I've ever known, all I have. I don't know what I'd do without him.
That squeezing chest pain must have been your tip-off that Mr. Crowley was having an MI. It's usually caused by a blood clot forming in a coronary artery that supplies blood to the heart muscle. Without rapid intervention, the injured area will die. Well, I see we're in agreement about this patient's diagnosis. Excellent job of obtaining the patient's history. This patient was in good hands with you. Your treatment was first-rate.